The senator from Minnesota.
Mr. President, are we in a quorum call?
We are not.
Thank you. Mr. President, I rise today as millions of Americans stand on the edge of a healthcare cliff. And I join my Democratic colleagues in continuing to fight to reopen the government and to prevent Americans' healthcare costs from skyrocketing. A critical part of the governing is finding common ground. You don't always pick your neighbors, as the presiding officer knows, we have worked together many, many years. But you find a way to live next to your neighbors, as we do, and to work with them. Making healthcare more affordable should be a bipartisan issue. And some of my Republicans know we need to act, Republican colleagues know that we need to act and we need to get something done. And the overwhelming majority of Americans agree. I've worked that way in the Senate. For a number of years, I was ranked #1 for bipartisan bills and #3 for passing bills into law, because when we sit down together to work things out, we can get things done. Courage is about willing to stand next to someone you don't always agree with for the betterment of this country. And that means finding some common ground. It doesn't mean saying my way or the highway. It doesn't mean, when you're the President of the United States, canceling meetings, doing one at the last minute, and then with the Democratic leaders of our country putting up a deep fake video that was incredibly offensive, poking at them, instead of taking this issue seriously. They came to him in good faith and still do. Unfortunately, right now, our Republican colleagues are not working with us to find a bipartisan agreement to prevent the government shutdown and address the healthcare crisis. We know that even when they float ideas, which we surely do appreciate, in the end, the president appears to make the call. He made the call on tariffs, even though so many of our Republican colleagues disagree with him on that. He made the call on certain nominees like RFK Jr. He made the call when it came to certain of the provisions in the big, beautiful betrayal of the bill, many of which our colleagues didn't like, including the nutrition program decision at the end to reward the 10 states with the highest error rate when it comes to SNAP. I note none of them are in the Midwest. That is why my Democratic colleagues and I want to reach an agreement, not only with the Republicans in this chamber, but we also need the president at the table. He prides himself for the art of the deal, and it's time for him to make a deal. We are working so hard to make sure that more than 20 million Americans who rely on the Affordable Care Act, it's called different things in different states. In my state, it's called MNsure, to access affordable health coverage. It tends to be a lot of individual buyers in the market. It tends to be a lot of small businesses. And over a quarter of the farmers in this country rely on it. Again, it's called different things in different states. But what it is a plan to allow people who maybe aren't at a big corporation to be able to have health care. A while back, they didn't even want to leave a big company, or if they were left without being at a big company or in the government or something like that, they couldn't even get health care at all. That's why the Affordable Health Care Act was passed. I'd make a lot of improvements to it, and we do have some opportunities to do that. But right now, we need to make sure that we don't push them off a health care insurance premium cliff. And this is on top of the draconian Medicaid cuts that are going to push 15 million people off their health care that were in the big, beautiful bill, and also the Medicare cuts, which no one intended to have $500 billion in Medicare cuts, I guess, of our colleagues on the other side, but the debt accumulated from the bill of $4 trillion was so big that it triggered automatic Medicare cuts, which are hitting and are going to hit rural hospitals, which they are now putting into their bottom line. And while they're staring that down and the Medicaid cuts, they're also looking at the fact that so many of their patients and people who visit rural clinics that often tend to be in the hospitals are on the Affordable Care Act, because rural areas, and I'm focused on rural areas because I just went on a 13-county tour in my state, rural areas tend to have more people that are small business owners, percentage-wise, and also that are farmers and ranchers. So this is not a December thing. This is not a January thing. This is a now thing, because those premiums are hitting on November 1st, when that market opens up. So right now, millions of Americans are staring down the reality that their health care premiums could double. For many families, that will mean making impossible choices to make ends meet or losing coverage altogether. This is preventable, but we have to act now. Over 20 million Americans are enrolled in Affordable Care Act health insurance plan. If we don't act, they're going to be forced to make impossible decisions. And that doubling number, that the premiums are going to double, came out of a study just this week by the Kaiser Family Foundation. If Congress doesn't come together in a bipartisan way to extend these credits, these families, farmers, ranchers, small business owners, entrepreneurs, seniors, people living in rural communities will have to pay an average of double every month, hundreds of dollars more every month, not every year, every month, to keep their health insurance. In Minnesota, nearly 90,000 people will see their premiums increase by double digits. So you can say, well, I'm not on that kind of health care. I work in such and such company. You don't know the day, especially with these tariffs, when people are starting to get laid off at manufacturing companies like John Deere, or that a farmer's business goes bankrupt, his farm goes bankrupt because bankruptcies for small farms are at an all-time high in the last 5 years. You don't know when it's going to be you. It's like the lottery, especially right now with the crazy things going on in this economy. So even for people that aren't on the Affordable Care Act, this affects them. For many, this will put health care coverage out of reach. This is not political theater, I say to the president after he posted that offensive video. This is not a joke. These are real Americans that are facing these challenges. The loss of this tax credit will raise premiums for everyone. Minnesotans have already started to receive notice that their costs will increase. One constituent is bracing for more than a 27% increase in their premium next year. Another, whose husband's job was just eliminated, called the 19% increase in health insurance costs their family is facing incomprehensible with the loss of income that they already faced. And this is before adding in the extra costs people will be forced to take on if the tax credits are not extended. So if you noticed, I use those words 19 and 20, and you're thinking, well, she just said they double. This is before that happens. This is what's happening on the market right now because of a number of factors going on that the president should be dealing with. And people are going to be socked with this, smacked with this, right while the price of groceries has been going up. I think the president promised he was going to bring costs down on day one, and we're in something like day 255. And the opposite is happening. Anyone that goes in a grocery store and walks out, looks at their receipt, knows exactly what I'm talking about. Or people that are in the grocery aisle and see the cost of beef, they know what I'm talking about. Or people that get their electricity bill, they know what I'm talking about. Those aren't deep fakes. Those aren't fake videos the president puts up on Truth Social. Those are real bills. So especially as this is going on because of these tariffs, and could I just add, since I have the floor here, the latest, the tariffs on sofas and cabinets and lumber, it is already too expensive for Americans to buy a house or to rent a house or to rent an apartment. And now we're going to see major increases to home furnishings. And while we are in the middle of a housing crisis, it's literally one of the worst things he could do right now, but he did it. So all that is not nothing. All that kind of sets the stage for why the healthcare cost, which is one of the most expensive for people just on a yearly basis, is so devastating. One of my constituents shared that while they'd planned for higher premiums, they didn't expect a more than $2,000 increase for the same coverage next year. And like so many others, they were concerned that even if they switched to a cheaper plan, you know how that is, you're betting and you're trying to guess and estimate what's going to go wrong in your family, and is your kid going to have some kind of surgery or break a leg? Is your husband going to have some kind of health care checkup that'll be expensive. You got to always calculate those things. Like so many others, again, they were thinking, well, should I switch to a cheaper plan to save money and then hope I don't get sick? And then they would be more exposed to higher costs. Those are the kind of things people are doing right now. It's like the woman that Jean Shaheen had at a spotlight forum that we did this last week who had MS. And she had actually talked to her doctor about whether she could ration, kind of like people used to do with insulin with diabetes before we put those caps on insulin. Could she ration her medication for MS? And the doctor says, no, that's not how this works. It'll just grow the pressure in your brain and make your symptoms worse. Another Minnesotan wrote me that without the tax credits, their family of 4 would have to downgrade their health plan and spend significantly more on their health insurance than they do on their mortgage. Another said that he expected his family would have to pay an additional $16,000 per year for their health coverage if they had no health care tax credits. One Minnesotan shared, I cannot absorb additional costs and will be forced into a catastrophic plan if these reported double-digit increases go into effect. Just because someone can't afford to stay insured doesn't mean they need health care less. One of the things that I learned that maybe I hadn't thought through when I went to these rural hospitals was the fact that because there's a high percentage of these farmers and people in small towns on these plans, ours is called MNsure, like I said, they're already hit by the Medicaid cuts, right, the hospitals, the Medicare cuts, because it's an older population. But they actually cared a lot about this, the doctors, the nurses, the people running the hospitals, because they know that the people won't be able to afford this if these premiums double. They will choose not to get health care insurance. And then what will happen is they'll end up in their emergency rooms with hospitals that are already strapped thin, and they won't be able to afford, they will treat them, but they won't be able to afford it for a long period of time. So they time and time again mentioned to me that these affordable tax credits expiring or not being maintained would create a major problem. Already, approximately 1/3 of Americans report not taking medications as prescribed due to the costs. Jason from Pennsylvania was able to get life-saving coverage when he was diagnosed with thyroid cancer through the Affordable Care Act marketplace, and he said, it's only because of the premium tax credits that I've been able to afford that coverage. Now faced with the expiration of these credits, he understands the consequences for people like him. He said, if you're faced with a choice of bankruptcy or debt or saving your life, you're probably going to choose your life, Jason said. But the consequences of that, of having an immense amount of debt the rest of your life, could be ruined because of that. Another cancer survivor who has always made health insurance a priority also fears that unaffordable health insurance could mean for patients like her. And she says, it means that I don't have to wait around to find out about a disease that could have been cured if it had been detected soon enough. The insurance means I don't have to forego my entire life savings in my home because of medical bills. I don't have to forego life-saving treatment because I can't afford it, and that's all about to change. Without the tax credit, I don't know if I'm going to be able to afford health care, the kind of health care that's going to save my life. Already, as I noted, because of Medicaid cuts that were passed in the big, beautiful betrayal of a bill, more than 300 rural hospitals, 200 health centers, and 500 nursing homes are likely to close. This means less accessible care for rural communities, longer drives to access care, fewer places to seek care in an emergency, and more hours taken from work, caregiving, or other responsibilities. Fewer patients will go to that doctor's visit or get that life-saving screening. They will not get the surgeries they need. Many will get sicker. And ultimately, as I noted, more patients are going to end up in the emergency room, where these hospitals are going to have to take on the additional burden of more uncompensated care. None of this happens in a vacuum. As I noted, these Medicaid cuts And Medicaid provides health care for at least 1 in 5 rural Minnesotans, more than 31% of children in our state, and more than half of all nursing home residents across our state. So this is about seniors, people with disabilities, and kids, and that's why Medicaid's so important. For me, my dad, in his later years, got late onset Alzheimer's, and he was in one place, and then we moved him to another place. But I knew the exact date when his savings were going to go away. And we were going into those savings, and sadly, we lost him. But I knew that exact date, because I was going to have to move him to another nursing home, another assisted living that took Medicaid, and I made plans with them. I knew that date. So many people in this country know that date, even if they're not a senior relying on Medicaid. Their kids, their spouses, their grandkids kind of know when that savings, if they had any savings to begin with, is going to run out. So Medicaid goes way beyond the individuals who have no savings at all. It actually helps people that do have some savings. It helps people that have worked their lives through, like my dad. Medicaid is there as a safety net for people. Over the last few months, I've heard from thousands of constituents, including seniors in Minnesota, from Sunrise Village in Malacca that I visited, to senior living in Watkins or Winona, to the Pillars at Prospect Park, and Episcopal homes in the metro. They are worried about their health care. I heard from one constituent from Inver Grove Heights who told me that Medicaid helps her to afford the cost of her father's memory care. I think about what a constituent told me who works with adults with disabilities. She is a mental health therapist for a woman who had a tracheotomy and is wheelchair-bound who requires nursing care. She's also the aunt of a man with Down syndrome with many needs who's in a residential home. She said, "I'm concerned about the possible Medicaid service cuts to the people who most need it." I've also heard from a constituent named Lola, whose daughter was diagnosed with leukemia. A social worker advised Lola that her employer-based insurance may not cover the cancer treatments her daughter needed and connected her with Medicaid. She said Medicaid helped completely with the surgeries, the T-cell therapy. Lola said using my own insurance would have caused a lot of delays because it would not have covered what she needed. And Robbie, who after years in an adult foster care facility now lives independently with a roommate because of Medicaid's disability waiver and community-based services. I've got to meet some of these incredible Minnesotans visiting care providers who help people with disabilities, thinking about the progress we've made so people can either live at their home or they can live in a group home and they can have jobs, and we just can't go backwards. People will feel the impacts of these cuts, and we know it. And I'll close with this. After learning that her insurance cost is set to skyrocket next year, a woman asked, "What can you in the Senate do to make sure I don't have to stop getting my insurance?" We can do something, and it's something that so many of my colleagues agree with, especially after the cuts that were made, especially after the bludgeoning tariffs, what they're doing to the cost of things for people. It's not going to fix everything, that's for sure, but it's going to save a lot of lives, and it's going to help people contain costs so they don't go over that cliff. As Minnesota's former senator, I have his desk, Hubert Humphrey once said, "The moral test of government isn't just how it treats the young and healthy. It's also how it treats the sick, the elderly, and people with disabilities." That's definitely true for us right now. And I believe this is a moral test for all Americans. At a time when so many families are struggling just to make ends meet, we can't sit back here and just play a blame game and look at the polls and We can do something. It's really pretty simple. We must work to protect Americans' access to health care. We must protect our rural hospitals. We must address our health care crisis. As I know, it's not a December or January problem. It's a now problem. And it's completely within our grasp to do this. And it's certainly within the president's grasp to bring his party with him. So stop, Mr. President, posting those fake offensive videos and start helping Americans with their health care. Thank you, Mr. President. I yield the floor.